Scoliosis, causes and symptoms. Scoliosis causes the spine to curve to one side. The curvature can be in any part of the spine, but the most commonly affected regions are the upper spine and lower back. Scoliosis is most common in the later stages of childhood or the early teenage years when the person is still growing fast. It is more common in females than in males. Scoliosis is not always noticeable, but some people with this condition may lean to one side or have uneven shoulders or hips due to the curve of the spine. In most cases, the person does not need treatment because the curve often does not progress a significant amount. However, depending on the degree of curvature and the age of the child, doctors may recommend a combination of back bracing and physical therapy. A very small number of people with scoliosis may need surgery. Possible complications of scoliosis include chronic pain, breathing difficulties, and a reduced capacity for exercise. In this video, we provide an overview of scoliosis, including its causes and symptoms. What is scoliosis? A person with scoliosis will have a sideways C or S shaped curve in their spine. For a doctor to diagnose scoliosis, the Cobb angle, a measure of the curvature, must be at least 10 degrees. Scoliosis can appear at any age, but it often presents between the ages of 10 to 12 years or during a person's teens. While scoliosis is rare in infants, infantile scoliosis can affect people before the age of 3 years. In most cases, there is no known cause of scoliosis. Doctors call this idiopathic scoliosis. In other cases, scoliosis may have an association with cerebral palsy, muscular dystrophy, or spina bifida. Alternatively, it may be a birth abnormality. Doctors will classify spinal curves as structural or non-structural. A structural curve is permanent and may be due to a medical condition or injury. A non-structural curve is temporary, meaning that the spine is structurally normal. In either case, a doctor will try to find and correct or treat the cause. Symptoms. Scoliosis usually becomes apparent from infancy or adolescence. The symptoms differ depending on the person's age. Symptoms in adolescence. The most common form of scoliosis appears in adolescence and is known as adolescent idiopathic scoliosis. It can affect people between 10 to 18 years of age. Symptoms can include the following. The head may appear a bit off center. The ribs on each side may be slightly different heights. One hip may be more prominent than the other. The clothes may not hang evenly. One shoulder or shoulder blade may be higher than the other. The person may lean to one side. The legs may be slightly different lengths. Some types of scoliosis can cause back pain, but it is not usually very painful. This symptom is more common in older adults. Symptoms in infants. In infants, symptoms can include a bulge on one side of the chest, consistently lying with the body curved to one side. In severe cases, problems with the heart and lungs, leading to shortness of breath and chest pain. If an infant does not receive treatment for scoliosis, they will be more at risk of problems later in life, such as impaired heart and lung function. Cause. Some of the possible causes of scoliosis are neuromuscular conditions. These conditions affect the nerves and muscles. They include cerebral palsy, poliomyelitis, and muscular dystrophy. Congenital scoliosis. Congenital means that the condition was present at birth. Scoliosis is rare at birth, but it can occur if the bones in the spine develop abnormally when the fetus is growing. Specific genes. Researchers believe that at least one gene plays a role in the development of scoliosis. Leg length. If one leg is longer than the other, an individual may develop scoliosis. Syndromic scoliosis. Scoliosis can develop as part of a medical condition including neurofibromatosis or Marfan's syndrome. Osteoporosis. Osteoporosis can cause secondary scoliosis due to bone degeneration. Other causes: poor posture, carrying backpacks or satchels, connective tissue disorders, and some injuries can cause spinal curvature. Diagnosis. A doctor will carry out a physical examination of the spine, ribs, hips, and shoulders with the aid of a tool called an inclinometer or scoliometer. The doctor can measure the degree of scoliosis. An angle greater than 10 degrees indicates scoliosis. Imaging scans such as X-rays, CT scans, and MRI scans can help the doctor assess the shape, direction, location, and angle of the curve. The doctor may refer the person to an orthopedic specialist for further advice. Types. The Scoliosis Association in the United Kingdom describes 7 main types of scoliosis: congenital scoliosis, early onset scoliosis, adolescent idiopathic scoliosis, degenerative scoliosis, neuromuscular scoliosis, syndromic scoliosis, Scheuermann's kyphosis. Risk factors. The risk factors for scoliosis include age. Signs and symptoms often start during a growth spurt just before puberty. Gender. Females have a higher risk of scoliosis than males. Genetics. People with scoliosis often have a close relative with the condition.